Hey guys, coming from the operating room, we're doing an upper and lower blepharoplasty with a brow lift and fat transfer. I'm going to talk to you a little bit about fat transfer as it relates to stem cells. So as we discussed in previous talks about the very popular field of regenerative medicine, stem cells and stem cell treatments are one of the hallmarks of regenerative medicine. So there's a lot of crossover between regenerative medicine and plastic surgery of the face. And we employ a number of techniques such as fat transfer / stem cell transplant, PRP, even hyaluronic acid, and the new hot topic, which we'll talk about in another talk, exosomes. So today we're talking fat transfer. So as you saw, we harvested fat from this patient's thigh and we processed the fat by removing some of the excess fluid. But the nice thing is we preserved stem cells. So stem cells, classically, we think about embryonic stem cells or stem cells that come from fetal tissue or fetal blood. These are adult stem cells. So we have adult stem cells in various tissues of the body. The common one we think about is bone marrow, but in our fat tissue, we have what's called adipose-derived stem cells. So when we take fat, we're doing two things by injecting into the face. One is we're adding volume to fill in hollowed areas or areas of volume loss. But the second thing we're doing is we're transplanting stem cells. So when we transplant those stem cells, what do? Well, stem cells are involved in healing tissue and growing new tissue. We use it in cosmetic facial surgery. We get the benefit of improved healing, faster healing by using those stem cells, but we also can use those stem cells to either produce more stem cells, so adding additional stem cells into the face, but they can also then go and form other types of cells such as muscle cells or even bone cells. So in an aging face where people are losing not only fat volume, they're losing bone volume, there's a potential that by transplanting stem cells, we can actually regrow some of that tissue. So that's a really cool side aspect of fat grafting. But what you see here is we've processed the fat and we're going to use these little cannulas and inject it here. Okay, and we're using what's called a modified Coleman technique. That's a really gentle way to harvest the fat. You can see how we harvested fat. We did not use a powered liposuction. So the Coleman technique or the manual liposuction really has the highest rate of preserving not only fat tissue, but the stem cells. So we're gonna do our stem cell fat transfer for this patient. And the cool thing is I notice a lot of my patients, not only come back revolumized, but they also talk about improvement in their skin, the skin tone, the texture, the ability for the skin to be well hydrated. And I think that's related to the stem cell transplant. So I'm really excited about regenerative medicine, kind of a hobby / interest of mine. We're gonna keep talking about other aspects of regenerative medicine and how we use them in the practice, but I thought you'd be interested in that. Have a great day.